And not only, as Sharon says, do we minimize our symptoms at menopause, we then, with an increased risk of cardiovascular disease, since our menopause symptoms have been minimized, now we have an increased risk of heart disease. We minimize our heart symptoms as well.
Yes.
The symptoms of a woman may be different from a man. And what do we say? Sometimes you may not have this crushing chest pain, shortness of breath, you collapse in the street, this big dramatic event where everyone comes and rushes to save you. You may have something, you may just be chronically tired. You may have chronic back pain, or you might have jaw pain that might take you to the dentist. You may feel run down, or as if you have the flu, when in fact, you actually could be suffering a heart attack. And it's the reason why women postmenopausal, their first incident of a heart attack that takes them to the hospital is oftentimes fatal, as opposed to a man. It's not because your heart attack is larger, it's because it's gone on for such a long period of time while you have minimized those symptoms. And here's the scary part, your doctor may have minimized them as well. There's not even a large percentage of physicians that feel comfortable managing a woman when she comes in really with cardiac symptoms that are considered atypical. And we've got to get away from saying a woman's symptoms are atypical. Maybe it's the man's symptoms that are atypical. Maybe we're actually having the normal symptoms. And we need to make certain that we learn what the normal symptoms are first and then extrapolate it to the atypical. So who's to say who's having the normal symptoms or not?
That is exactly